The three main players, Medio IGC 202, Unit 4. I'm Dr. Isabel Souza. Very happy to be your presenter today again. Let's move on to the topic at hand. And let's talk about the triadic interaction. Typically, we call it a triadic interaction because we have three main parties. We have the patient, the provider, and the interpreter. Even if they do or not bring others with them, typically it's only the three individuals, but even if there are more individuals involved, they're going to be on the periphery and they're not going to be the primary communicators of the main communication at hand. And even though I say we have three main individuals, let's not forget that the patient-provider relationship is the most important. So if you hear triadic interaction, triadic session, it simply means that it's going to be a conversation with the third party, and we're the third party. So let's move to the next slide here, and you're going to see, let's go one by one. The patient. The patient may be in pain. Patient is typically worried about a certain health issue. Most patients that we see are frustrated by their inability to communicate directly. They rely on extra services just to get by. They can be uncomfortable discussing problems. Depending on the situation at hand, they may be very uncomfortable. Sometimes health issues can be quite sensitive or deal with areas of our body that we're not comfortable with, speaking about it. So, we have to really remember that the patient is always in a state of unease, if you will. And they may be intimidated by the provider, either because the provider is intimidating or simply because culturally, they feel that that is the way it should be, that the provider has all the knowledge and they're just someone attempting to get some help. So we have to really remember the mindset that the patient may have. Let's go on to the next person here in the triadic relationship, and that's the provider. The provider has their own issues to deal with as well. They may be rushed due to the appointment schedule, and that's something that really can affect a provider's ability to serve their patients. We have to realize that most appointments are scheduled every 15 minutes, and patients, providers actually have a very tough schedule to go by. They are concerned about getting an accurate diagnosis. That's their goal, and they want to do their job right. They may be confused by unfamiliar facial expressions. If they're not familiar with the patient's culture, language, behavior, body language, they could be a little frazzled as well. They may be frustrated by their inability to communicate directly. They may be frustrated just by having to rely on an interpreter. And they can also be sometimes frustrated by the descriptions provided by the patient. Maybe the patient is a person who discusses issues in a circulatory manner and doesn't get to the point, and the provider just asked a simple question, but the answer doesn't seem so simple. So both parties can have their own frustrations, and the provider could actually be baffled by the patient's behavior, not quite understanding why a patient would act or say certain things. So we just have to remember the state of mind of the parties involved and realize that they also can't always come with a clean slate, and they may have issues they're bringing into the appointment. So let's move on now to the interpreter. The interpreter may be worried about unfamiliar terms. The interpreter may be struggling to interpret long phrases. The interpreter might also be embarrassed by the subject matter at hand. The interpreter may be anxious to accommodate the provider and the patient. And I'll say something here is that, you know, we want to help all the parties, but when we get anxious about it and we're trying to please, we stop doing our job. So we really need to focus on our work and doing the best job possible. We can be concerned about roles. As I mentioned before, interaction can be difficult sometimes when you have three parties. One party maybe doesn't know how to stop speaking, so you can interject and interpret. Maybe another party is talking over you and you have to stop and request that they allow you to finish your interpretation before they start speaking. Maybe, you know, all those things. When you have three people communicating and you're the mediator between those two people, everybody has their own role and everybody needs to be clear on their role. And on occasion, somebody might step on each other's toes. And so we need to be careful not to do that with the two parties we work with, but also ensure that they're not doing it to us and not just allow it, because it can really affect the quality of the interpretation. So let's move on to the next slide. And, you know, think of a communication interaction or a communicative session. It can be affected by the setting, the environment. I've talked about noise. Noise doesn't simply have to be real noise. It can be other kinds of noise. Any kind of destruction could be considered noise. The purpose is going to be affected by the purpose. Maybe it's an easy purpose. Maybe it's a difficult purpose. Maybe the provider's trying to convince the family member to take the patient off the ventilator. You know, offhand, it's going to be a difficult conversation. The participants' relationships with each other, that affects the communicative interaction. Why? Because they might already have a wonderful relationship. Maybe Dr. Smith and Maria Gonzalez have already seen each other many times and have developed a nice rapport before you even came to the picture. Or otherwise. And then their state of mind. Everybody's state of mind, as I mentioned before, can affect the communication interaction. So the best thing we can do as interpreters, we can't control other people's thoughts and behaviors, but we can control our thoughts and behavior. So we can think of our state of mind, really hone into the moment and sort of forget what's outside. We can try to focus and engage in active listening and professional discourse. And once we do our part, you know, we can feel good that we are not creating any noise ourselves with any of our issues. So let's go on to the next. The duty of the interpreter and the provider. Well, both have to abide by their own code of ethics. And, you know, one of the code of ethics that actually we have in common is neither of us want to do the patient any harm. And the interpreter does this by interpreting accurately and not skipping or adding anything. And the provider does this by really putting all their attention to the patient's care so that they don't do anything that can cause the patient harm. The other one that we both abide by is that we are committed as healthcare professionals to treat all patients with the same level of respect and level of care. The interpreter has a couple of responsibilities that he or she may have to juggle, right? We've talked about them, whether they're positioning themselves correctly, whether they're addressing all the noises and issues that are affecting communication, whether they're engaging in intercultural communication when it's necessary, and so forth. The interpreter must interpret the communication accurately and completely, and that is definitely our utmost responsibility. The provider has, a couple of other duties. The provider will obtain an accurate patient history, will perform a physical exam, and will also, once she or he has diagnosed the situation, will prescribe some kind of treatment options for the patient to undertake. So let's move on and think about the office visit. The primary reason people make an appointment is because they have an illness, or maybe it's a follow-up to an illness and it's sort of like a check-in to make sure that the issue is concluded. Or it could be a referral from an issue that hasn't been resolved in one level of care, and now that appointment is being made with another physician to see if that issue, can be addressed. So let's think of the anatomy of an office visit. The first thing that always takes place is introductions. We already discussed, the things that interpreters need to introduce when they start interpreting, and we've talked about, introducing our name and language. According to the Joint Commission, every patient needs to know the names of all the individuals that are treating and working with them. So that's why we do this. The confidentiality, speaking directly, interpreting everything, all those things are important in our introduction. And obviously, we need to give them a chance to introduce themselves to each other if they don't know each other. After introductions, you typically have the whole sequence of obtaining the symptomology of the patient, asking the patient why they're there, what's happening, and that's where the provider will guide the discussion. And as we interpret, we're typically interpreting sort of a Q&A or tell me what happened. Some providers are now using more open-ended questions, and then patients are able to tell their story. Once the patient does that, as the patient is doing that, the provider is already trying to diagnose the situation. And at the end of that conversation, the provider typically gives some kind of a treatment plan for the patient to discuss, answer any questions they may have, and either comply and say, yes, let's go for this, or no, I want another option. And that conversation might go through another loop and another loop until the patient is accepting what the provider says and they're both in agreement of what's going to happen. At that point, we have the closure activities. The IMIA Standards of Practice actually has a page on this, and they talk about how the interpreter may ask if any parties have any other questions to direct to each other before they finish interpreting. Sometimes the interpreter, if you're a staff interpreter, you may have to follow the patient and help the patient as they're scheduling their next appointment. If you're working remotely, the interpreting session might end right there. But it's always nice to, to close and not just, hang up. So it's important to have the three primary parts of any office visit. And we're going to end this unit right here. And thank you so much for listening to this unit lesson.